Are we having too few children too late in life? Sounds like a challenging question, doesn't it? Well, that was the title of a research paper I stumbled upon a few years back. It's a tough question to face individually, but it's one that's crucial in a society that's rapidly aging. In just 25 years, the number of people aged 85 and older will double. The big question is, will they be able to live well? Will we be able to live well? As an advanced economy, you might think the United Kingdom has all the necessary systems in place to ensure people live well in old age. We've got a pension system, a universal healthcare system, though we do grumble about it, it's still among the best in the world, and a social care system. But here is the reality check. Despite the pension system's aim to provide financial security, the poverty rate among those 65 and older has jumped from 16% to a staggering 38%. The social care system has been in crisis mode for more than 2 decades. And let's not forget the NHS. When was the last time you heard it wasn't struggling financially? My 20-year research journey has led me to a clear conclusion. These systems are not fit for purpose anymore, given our current demographic and socioeconomic landscape. That's why I've embarked on a new strand of research, which I'm currently working on within the Connecting Pensions, Health and Care project, generously funded by the Nuffield Foundation. You see, when these systems were first designed, the population age pyramids actually resembled pyramids with more younger people and fewer older people. But the times have changed. We are having fewer children later in life, and they are often living farther away from us. Plus, we are living longer thanks to healthcare innovations. But many of these advancements come with hefty price tags. Yet, despite these significant societal shifts, we still cling to the idea of a free healthcare, expect decent pensions, and give little thought to who will provide and pay for our daily care when we are frail. And let's face it, we are not exactly thrilled about the idea of paying higher taxes to fund it all. As an economist, I am deeply concerned about the challenge of meeting unlimited needs with limited resources, especially in the face of an aging population. Our needs are growing, but our resources aren't keeping pace. So as a society, we need to have some tough conversations. Do we want more? Then we may need to agree to pay more. Or if we are not keen on that, we'll need to figure out which needs we can afford to leave unmet. But this is the stark reality we face, a reality that demands we confront our fears and uncertainties head on and work together to forge a future where all of us, regardless of circumstance, can truly thrive in our later years. I am Olena Nizalova, the principal investigator of the Nuffield-funded project Connecting Pensions, Health and Care. And we are on a mission to find sustainable ways to support people living well in old age.